Live from the broadcast center in Los Angeles, this is KCAL 9 News at 4.
As we told you at the top of our newscast, an FDA panel has recommended Pfizer get an emergency use authorization for its COVID-19 vaccine. The full FDA is expected to follow that recommendation soon.
That's right. Today, the panel concluded the shot is safe and effective for people 16 years of age and older. This is a major step forward in the battle against the pandemic. Dr. Victor Waters, the Chief Medical Officer at Dignity Health St. Bernardine Medical Center, joins us now to help us further understand the vaccine. Doctor, thanks once again for joining us today.
Thank you.
All right, first off, how would the vaccine work to actually slow the spread of the virus?
Well, the vaccine can stop more infections from spreading. That's the theory. More of the population gets properly vaccinated, then the areas that the virus spreads can be reduced. The idea is to get to the highest risk populations, our communities, our Black and brown communities, our nursing homes, and if we can stop those high risk populations from spreading, we can begin to curtail the spread of the COVID virus.
And Dr. Waters, this question is actually from a viewer. Now, if someone already had COVID-19 and they have the antibodies, do they still need to get a vaccine?
Very good question. And, I'm going to say the short answer is yes. If someone's been exposed to the COVID and may have antibodies, for example, there's just no evidence that this is long-lasting surety that that person is protected. So it would behoove them to get vaccinated also. Now, of course, there are people who have recently been infected with the COVID, maybe even hospitalized and come home to rehabilitate and feel better. Those patients logically won't need the vaccine immediately, but there's no guarantee that they won't get reinfected at a certain time period. So it does behoove us to get the vaccine.
And doctors, some people may be concerned about some of the potential side effects we've been hearing about. What's important for them to know? And also, on a personal level, will you be getting the vaccine as well?
Let me start off with, I've looked at the data preliminarily. It's very promising. It's in terms of the efficacy, it's well over 90%. Anything over 50%, such as the flu vaccine, is good news. The safety data is good news. So I'm going to answer the first part. Yes, I am committed to getting the vaccine. It's important to lead by example. It's important to show that the vaccine actually is safe. And I am one of those folks that are in the risk factor as an African-American physician. I'm at risk as an African-American. So I want to show the safety of the vaccine. Yes, it's very important. There are side effects. We're aware of the typical side effects of fever, muscle aches, fevers, myalgias, muscle aches, and fatigue. Now, there may be more severe symptoms that may take a person who gets the vaccine to recover a day or so. But overall, the studies that say it is safe, and it's important to understand the benefits outweigh whatever risk of side effects that are short term.
And doctor, one final question for you. The vaccines that we're talking about right now, obviously for adults, we're just starting to talk about them for teens. Anything else that you're hearing about for children?
Yeah.
No, nothing else for children right now. Again, that population, doesn't transmit the virus as easily, particularly those children at 10 years of age. And they don't get as readily sick as the elderly population of those with comorbidities. So I'm sure there's going to be more studies really drilling down to the efficacy of the vaccine in children. But at this point, it's much more effective to target those populations that are at risk.
All right. Thank you, Dr. Waters, so much for all that information and for joining us this afternoon.